Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.
Hi, everyone. Thank you so much for joining. I believe we can start. My name is Sheila. I'm part of the academics team here at Humanitarian Global. I will be the moderator for the session today, and I look forward to getting to learn a lot from our experts, as well as from you guys, even as we try to learn about our topic for today. And I believe we know that our topic for today is integrating gender perspectives in monitoring and evaluation, strategies that we can use for inclusive monitoring and evaluation. So I look forward to getting to learn more about that, because we are blending two different areas together and see how best we can be able to achieve the best of it. So with that, thank you so much. We will be starting with a bit of introduction. So introductions, basically, you can always drop in your name and which country you're from, and also what you do, so that we can throw in a shout out and get to appreciate that you joined the session. And then I'll also give a chance to my team here at Humanitarian Global to just be able to introduce themselves. And then from there, I'll give you a brief of what we have in store at Humanitarian Global this year, and in respective to what we are training today. And then from there, we'll give a chance now to the experts of the day to be able to take over the session. Something to note is after the session, we'll have a session for question and answer. So if you have any questions, one, you can drop them at the Q&A section, so that now we can be able to answer them as we move along. And then two, we'll give you a chance to raise up your hand, and then you can be able to ask your questions, so that now you're also able to see what you have in store. Something else I need to mention, we will be sharing the resources and the recordings for this webinar to your emails. So don't you worry, you will be receiving all these resources, hopefully by close of business tomorrow. Okay, so I believe that's pretty much it. I can believe you can see me. This is Sheila. Joined in by our expert for the day, who I will allow him to be able to introduce himself, so that now again, even he can be able to, just tell us his name, and then we can proceed. He'll take in a lot of time later on as we move along. Francis, are you able to introduce yourself?
Sure. Good morning, good afternoon from the different locations we are connecting. Can you confirm that you can hear me?
Yes, we can hear you. A bit faint, but I believe yes. Let's say yes, we can hear you.
Good, I can see thumbs up. Guys can hear me. My name is Francis Kadiri. I am a gender equality and social inclusion practitioner or expert or specialist, and I'm really glad to join the panel, and we'll be having this discussion with us in a short while. Back to you.
Great. Thank you so much for that brief introduction. And I want to give a shout out to Valerian Mbadi from Matrust. Welcome to this session. We have Onesfo Hakizimana from Rwanda, who's the head of research, inclusion, meal, and advisory services at FATE Consulting Firm. Thank you so much for joining. We also are joined in by Robutara Francesca Mpanja, who has just graduated with a master's in transformative change in sustainable development, having been done a major in meal, gender, and social differences and sustainable development. This is one would have been also part of our panel. So I look forward to getting to learn a lot from you, Francesca, as well from United Kingdom. Thank you, everyone, for that. So with that, I think I would want to share what we have in stock at Humanitarian Global. My colleague will be sharing a bit of resources on chat, so that now you can always have or aware of what you have in store. So part of our deliverables are a training on monitoring and evaluation, which is monitoring, evaluation, accountability, and learning, which we believe is very helpful in our day-to-day movement, as especially with stakeholders and other different people in our organization. So for you to be able to improve your skills in project management, meal planning, data collection, data analysis, meal presentation, and all that, it will be good for you to join this course that we have in store. Please note that our program is divided into 3 different areas. We have the online certificate program, which takes 3 months. And then you also have the diploma program that takes in 6 months. And then you also have the postgraduate diploma program that takes in 1 year. It's different because for a certificate program, it's usually just the basic of what monitoring and evaluation is. We get to know about the history of it, the essence of meal planning, for us just to be able to introduce you to what monitoring and evaluation is all about. But then again, when you get to the diploma program is now when we get the nitty-gritties of monitoring and evaluation. And at that point, we get to learn about the different design logic models, data collection, data analysis, and how best can you use this meal data. And then finally, when you get to graduate and now do the postgraduate diploma, we will now emphasize on the aspects of evaluation. We look at the approaches as well as the design. So do make a point to register to some of our trainings. We'll also have a training on gender. That is one of our trainings that we're going to be offering. It's a 2 weeks training if you're doing it online, but then if you're doing it on site, we have it as a 1 week or 3-day training. Please make a point of registering for the same. I will be able to share the links on chat as we proceed, but now you can have more information about what it's all about. So with that, allow me not to take in so much time from our expert. I want to introduce now our expert to give us what he has in store. And as he does that, I want to appreciate and send a shout out to Pacific from Rwanda, who's the manager of insights at FATE Consulting Limited. I'm seeing you have 2 colleagues from there. Thank you so much for joining. We have Asegid Tadese from Ethiopia. Thank you so much for joining. And then you have Talpul Ali Murad from Islamabad, Pakistan, as an M&E practitioner and currently leading and managing child, early and forced marriages project in province Balochistan and Sindh. Thank you so much, everyone, for that. So practice. This is your chance to be able to introduce and take over the session. Are you able to share your screen? If you have any comments or clarifications, please also drop them on the chat feature, especially if you're agreeing with what Francis is talking about, adding more weight to that. Thank you so much and welcome, Francis.
Thank you so much. Integrating gender perspectives into monitoring, evaluation, accountability, and learning is a session that I want us to discuss in this session. So we start by just laying the foundation to understand, because this is a monitoring, evaluation, and accountability system. Then what is a gender responsive MEAL system? What do we mean by having a system that is gender responsive? Because generally in our programming, we say we are working towards a gender transformative system, and responsive is a step towards getting to transformation, which is the highest goal in our programming that we seek to reach. So we define it simply by saying that a gender sensitive or responsive MEL system is a system that recognizes and addresses different needs, experiences, and realities of individuals based on their gender. Now, this brings to the understanding then that the populations that we are reaching with our different programs or our different interventions have got different needs, have got different experiences, have got different realities. And unless we understand those needs, we understand those experiences and realities, we could be missing a very important point in making our interventions very effective and to achieve the intended outcome. Allow me to give an example of a program that is reaching adolescents and youth 15 to 24 years. This is not a monolithic group. Within this group, we have different subgroups with different needs. There are adolescents and young people with disability. There are adolescents, girls who are pregnant. There are some who are in school. There are some who are out of school. There are some who are married. There are some who are not married. All these ones have different needs and have got different experiences and have got different realities. Therefore, the system should be able to recognize and address these differences. And as we are collecting this data, we should be able to be cognizant of these changes. Why does that matter then for us to be able to collect this? Number one is to promote accountability, that we are tracking our program impact into different groups and ensuring that they are not, that our interventions and our programs are not inadvertently causing harm. Now, because we do humanitarian programming, for those that are doing humanitarian programming and development programming, there's a common term in programming that we say do no harm, meaning that interventions that are intended for good might end up actually causing harm. And how do we ensure that we do not cause harm? Unless we track our interventions, the impact of our interventions, the reach of our interventions, the outcomes, we can, at the end of the day, cause harm where we had actually intended to cause good. So this process of ensuring that our system, or having a system that is gender responsive, ensures that we are promoting accountability of our systems. We are also enabling the community to talk to us and to tell us how our program is, and I'll speak to this much later, give us feedback, and that we are able to work on that feedback to improve the outcome of our programming. Improving program effectiveness. Our programs can only be effective and achieve the results we intended to achieve if we fully understand our targeted audience. We have come out completely, and I really hope all the partners listening to us today, or the different programs, have come out of one fits for everyone. This is an intervention that addresses all the challenges to contextualized interventions nuanced to particular challenges of a particular area, addressing the very specific needs and experiences of that woman, that man, that minority, that vulnerable person. And that is why a gender-responsive system is important. It enables us to address those nuances, to address those different needs, experiences of those different groups, to ensure that our interventions are effective. One of my previous bosses, whom I've never forgotten, I worked with him over 15 years ago, kept on telling us that in our NGO work, we can throw lots of dust to people with big 4x4 vehicles and end up not doing effective interventions. Years down the line, I've kept on thinking back, what is an effective intervention? These are interventions then that really understand what are the needs, what are the issues, what do we need to put weight on when we are programming, what are the factors we need to consider, and these systems can enable us get there. Third point is addressing inequalities. There's so much inequalities in our communities, power dynamics, things that hinder autonomy of adolescent girls and women, things that affect voice and choice, broadly called agency, things that affect health-seeking behavior, things that affect rights of an individual over access to particular services and so forth. So how do we address these inequalities and ensure that we are addressing the impact of those to how an individual experiences a program and the benefits of that program to that individual? So those two slides basically help us understand what is an MEL system, a system that responds to people's needs and preferences. Why is it important? It's important because it enables us to improve our accountability, improve our effectiveness of our program, and helps us to address the inequalities in the community to ensure we live true to the words in our sustainable development goals, that we live no one behind. So how do we embed this in our monitoring, evaluation, accountability, and learning systems? The what and the how. What do we need to do? How do we need to do this? And because I don't see the chat box, in case there is any question, moderator, you can just feel free to interject and pose, or do you want me to go to the tail end then to take the questions?
Yes, let's work with at the end, we can take the questions.
At the end, thank you so much.
Good.
All right, let's start with the monitoring, because there are 4 things in this, in MEAL. The monitoring, the evaluation, the accountability, and the learning. So I want to start with the monitoring. In the monitoring, which is a regular process of collecting project data on a regular basis, monthly basis, just to see how we are progressing. First, we say in a gender sensitive or a responsive system is that we are collecting sex and age disaggregated data, SAD data, sex and age disaggregated data. Our data must be separated by sex and recognition of the different sexual minorities that we have, then disaggregated by different age cohorts, 10 to 14, 15 to 19, 20 to 24, 25 and above, based on your program dynamics. Then we do not stop there. Do we have a column to pick disability? For example, is there an individual with disability whom we are reaching? Where are we capturing that individual in the registration form to understand? And this is basically to understand the differentials between our participants. I like telling programmers that many times we have used registration forms for accountability purposes, for financial accountability, to say we had 50 people for the conference package. But ideally, these forms should also be used to explain, to help us understand our reach. When we are looking through it, we can be able to see which age cohort did we reach, what are the differentials, were there people with disability in the meeting, did we have representations of the different age group based on what we had set out to do before the meeting or before the intervention. The SAD data, sex and age disaggregated data, is then supplemented with qualitative data to capture other gender dynamics that are not quantified. So how do we know that we are changing gender attitudes? How do we know that we are changing gender dynamics in the community? Men are becoming more open. The community is becoming more gender-free. We're having more equitable distribution of labor. We are freeing up time burden for women. They're able to engage in other productive tasks. Those are qualitative indicators. So in a good MEL system, then we should be able to have those qualitative indicators to supplement the quantitative, and which are not normally collected on a monthly basis, but can be collected on an yearly basis. And there are several scales out there, the MEL scale and the rest, that can be able to be administered to know whether we are changing attitudes, we are changing perceptions, we are changing feelings towards particular things, to know whether we are actually advancing in getting towards our outcome. So gender sensitive indicators then become very important to put into our MEL plans. So these indicators help us to track and assess outcomes and impact from a gender perspective. So we have the general MEL framework that captures, we intend to reach women of reproductive age, improve women accessing productive resources, women accessing reproductive health services. What are the indicators in the MEL plan that are specific to gender? Are we improving women decision-making ability? Are we improving couple communication between partners? Are women able to engage their spouses on the use of family planning services, for example? What are those specific gender indicators to measure specifically gender outcomes and gender perspective in the program? So examples of this may include indicators on participation, where women have not been actively participating, or girls actively participating, or men, or minority communities. Are we able to check this? Access to service, decision-making processes, change in gender norms. Do you have direct outputs that are able to measure this? And the frequency and clearly outlined frequency of collection of this data and the subsequent tools that you are using to measure. For instance, are you able to build the decision-making ability of the group that you are targeting? Evaluation. What is a gender-focused evaluation? Then what do we need to do? How do we need to do it? Design evaluations that examine gender impact of the intervention. Now, for a good project, and if we want to achieve this, we must begin from the root cause of the program, because we will not just embed gender perspective in the MEL system if we did not deliberately and purposely begin the process from the root. Now, what is a root? When we are designing and beginning the program, we must start with the JC analysis, JC, gender equality, social inclusion, which is a bigger lens that carries the social inclusion aspect of it. So did we carry out an analysis that then looks at all the dynamics, all the gender equality, social inclusion dynamics, power dynamics, access to resource, roles, participation, and practices at the community, cultural and social norms? Did we understand what are the issues? This is basically understanding all the issues at that level when we are beginning. Then refining our interventions based on the findings of the analysis. And because when we are applying for funding, our frameworks, we normally present a framework already, but there is normally latitude and freedom that after we've done the gender analysis, we can go back and say we did an analysis, and based on the findings, we are refining our technical approach and we are refining our MEL framework to include these indicators and to refine these indicators in line with the findings that we picked at our analysis, so that we have direct indicators that are going to help us measure the impact of our work. So basically incorporating those frameworks into interpreting data, understanding how gender relations influence program outcomes. Now, one of the missing links as a practitioner in the field, I've seen many programs do gender analysis, yes. But after doing gender analysis, it's well folded, submitted to the donor, put aside. People continue programming as they used to program, as they had planned, not as they used to, as they had planned, as they had outlined with their donor, as they had promised their donor they are going to do. But what is the practice? You're saying after you've done the analysis, you must look at the analysis and ask yourself, how do these results, or how are these results likely to affect the outcome of the strategies that you had already proposed? Do these interventions need to remain the same in view of these findings? Are there adaptations that need to be made to these findings? And that speaks to, do the indicators need to remain the same, or the indicators need to be refined to respond to the refined interventions which are responding to the findings of the study, so that the entire MEL system, when it is monitoring, evaluating, taking accountability measures and learning, it is then responding to a refined system that has responded to the findings of the gender analysis. We encourage the participatory. By standard good practice is that participatory evaluation methods are what are encouraged when you're doing this analysis and you're designing these interventions and the indicators to measure. So you involve the diverse groups in the evaluation process. When you're doing your gender analysis, the tools that you're deploying should include, we've just given examples, you have given examples of focus groups, interviews, but there are many participatory methods that you can use at this stage to ensure that you're capturing voices of everyone. You're capturing voices of the very vulnerable and the very marginalized, and understanding how then you're going to measure impact across that, and ensuring that you have people who understand this process and are able to guide through this process. Accountability, another important aspect of the whole of the system. Now in accountability, I'll look at feedback mechanism, transparency, and responsive action. So what is an inclusive feedback mechanism? Does your program have an inclusive feedback system? A system that is accessible and safe to all genders. Why is this important? The populations we are serving, the individuals we are serving, need to have a system with which they can communicate back to us how our programming is reaching them, what are the issues they are having, the challenges they are having. Remember what I said earlier, the do no harm approach. I'll give you an example. One time we were programming in Turkana, and we are giving cash transfer. Those those doing humanitarian programming here know that either you can give cash transfer plus or consumption stipends in the times of drought and famine, or in times of shocks and stresses, just to ensure that you're able to sustain a household, they're able to get basic food supplies, and they're able to survive through the difficult period. Now, for them to access this resource, they had to travel some distance because there were no mobile money transaction booths around where they were, and they have to travel a long distance to come to access the money. So this lady comes from this particular home and has to travel and comes and accesses an equivalent of Kenya shillings 14,000. But on her way back with the money, which we have given in utmost good faith to support her household, she is accosted by men and defiled, and all the money is taken. And it's a very horrific scene, and it comes back to us that you subjected the community member to a lot of risk, because it is because of your 14,000 Kenya shillings that she has now been raped. For something very good to help her reduce harm, to help her get some supplies, to help her get food. But we did not look at the whole ecosystem in its completeness. How safe is she coming all the way to get the money? Could we have probably moved the resources closer to where she was? What were the other safe mechanisms for her to be able to get the money? Did we have a feedback channel to her to tell us, walking 10 kilometers to come to access the money is not very comfortable for me. It is difficult. I agree you're helping me, but it is difficult. But did we also build her ability to say that? Because she can feel saying that is a risk to me getting my 14,000 for support. So we had to quickly sit down after getting this information and rework the whole system around distribution of that money and make the process safer for the people that we are serving. And that included taking the money far closer, working with the super agents around the county, whom we asked them, we do not want the people coming to you. We want you going as close as possible to the people where they are safe, and working with the community administration and the rest to ensure that the people we were actually reaching are actually safe. Without a feedback channel, we can't be able to understand how best do we set up safe channels for the people. If there are cases of sexual abuse, there are cases of financial challenges, there are cases of people taking advantage of subjects that they are serving, and they are all over in the humanitarian world. Without a feedback system, we can't be able to know, and the feedback system has to be accessible. Even to a person with disability, have we made it possible? Sometimes we set up a system and we just say, this system is toll-free. Call it. It doesn't require any resource. It doesn't require your mobile airtime, but we haven't asked ourselves the question, the people we are talking to, do they even have a phone? And if they don't have a phone, how then are they expected to access that toll-free line? So thinking through accessibility and safety of that feedback channel to us, ensure that community members can provide input and hold the program accountable for gender-specific issues. Can the community hold you and me accountable for empowerment to the minority, to the vulnerable, to the women? Can we empower them? Can we empower the men? Can we empower the women? Can they question us and ensure that that inclusive feed, it is so important and so vital that we need to have this. Is it transparent and responsive? That once we have a report, are we able to act on the report and get back to the person and say, we received your report on this date, we have acted on it, this is the action we've taken, and you do not need to worry. We are now, your issue has been amicably resolved. That is report on how gender-related feedback is integrated into the program adjustment. And are there clear protocols for addressing gender-based concerns and grievances? The community members know that we can report the case here, this is a protocol, and then we will get feedback on what has happened to our case. Feedback mechanism that is very, very transparent, and there is responsive action that is taken from the project back to the community. That builds community confidence in us as change agents in our program and enables us to sustain the impact of the work that we are doing. Learning. Time is really running me out. In learning, we look at what are the gender insights. What is adaptive? What can we pull from the insights to infuse into adaptive management? Adaptive management basically meaning we are utilizing learning, utilizing the the data we are generating from the program to do adaptations or iterations to our interventions to make them more effective. And how are we in building our internal capacity and the capacity of our partners and the people we are working with, stakeholders, to implement more gender responsive or gender transformative programming. So gender-led learning process. We are analyzing and documenting lessons learned on the gender integration, including both successes and challenges. Again, here as programmers, we have a big challenge. We never like saying we have a challenge here. This did not work. We normally have that fear that if I tell the donor this did not work, they will feel like we wasted resources. But it's a strength to say we set out to do this. 6 months into the line, we realized we were not achieving. That is the purpose of learning. We had set out to do these interventions, this intervention to encourage couple communication to address gender dynamic where the man has been the dominant decision maker at household level. We realized it was not working. We made adaptations and iterations to that program. Now we are doing this and we are monitoring it over the next period of time to see its impact. That is adaptive management. So what are the lessons that we are learning? What are the challenges? What are the failures we are picking from our implementation that we need to change and we need to drop and do new things? How do we facilitate learning sessions with that special focus on gender issues, allowing teams to adopt and refine strategies which I have spoken to? Capacity building. Are we building our internal capacity and that of stakeholders to do a comprehensive gender analysis? Now, it is always bad when sometimes I find programs or you're asked to do, or you're asked to report in retrospect. We did not set out our systems to, from the onset, do a gender analysis, to set in responsive indicators, to set out our MEL system in a responsive manner. But finally, when the donor now is calling out for, we want to see these things. What are the gender dynamics? Now we say, let's think backwards. What do you think we did that is gender transformative? We are working in retrospect, which is not good. Whereas we should be purposeful and intentional from the very onset. So start with the gender analysis, then the gender strategy, which refines our interventions and puts up a strong MEL system. And that is a gender mainstreaming. Understanding the dynamics, putting them clearly into the MEL system, capturing all the perspective, the needs, the preferences in the MEL system, and understanding those diverse perspectives. Then fostering a culture of continuous learning. Pause and reflect. Pause and reflect and ask yourself, are we getting where we wanted to go? What do we need to change? What do we need to drop? What do we need to improve? My final slide. Then we get into questions and further discussions. What are the practical steps? Ensure that there is a comprehensive baseline. The gender analysis is a start point of understanding the dynamics, the role, the inequalities. This, as I said earlier, and I want to repeat it here, which is very important for our learning, once we've understood the dynamics, we use that analysis to refine our interventions. Once the interventions are properly refined, then those interventions have to be monitored and evaluated. Then we ask ourselves, are our indicators effectively now going to monitor our refined interventions? No or yes, no. We need to do something to our indicators, refine our indicators. As we refine our indicators, we pose the important question. Do we have indicators that are direct gender indicators to measure gender dynamics? Then we factor in gender indicators. We remember that in that MEL system, we are collecting sex and age disaggregated data quantities. Then we are supplementing those quantified data with qualitative data that will help us measure perceptions, attitudes, feelings over a period of time to see whether we are changing the gender norms, the social norms, and we are impacting the community. Secondly is collaboration. We must partner with gender experts and with the local communities to gain insight into the populations that we are serving and to gain legitimacy for our findings. Our findings have to be validated by the people we are programming with and for them to know. And I've put in important words that are very strong in the NGO world. Are we co-creating? Are we co-designing? Are we co-implementing? Some years back, we moved out of saying the community are beneficiaries of our program, and we began saying the community are participants in our program. That was a very important change. If we are still using it, that is. It's a very important change because it was empowering the community not to sit back and receive as beneficiaries, but to participate in the entire process, from the design to the creation of the interventions, to the implementation, and to the co-monitoring of the intervention to ensure that the whole system is gender responsive. Finally, is the allocation of resource. Again, a big gap that is in many programs. We talk gender. We say the way we want to empower women, girls, vulnerable communities, people with disability. But the question is, do we resource the process? Do we allocate resources for a comprehensive gender analysis? Do we resource the process for training? Do we resource the process for a robust and efficient monitoring, evaluation, accountability, and learning system? Do we resource the entire system to be able to get out the entire outcome? Now, if I was to turn biblical a bit, I'll say faith without actions is quoted in the divine book. I'm an Anglican, now we are in Lent. They say it's dead. So our actions are dead in the space of mainstreaming or embedding gender in our MAL system if we do not resource the process. And resourcing the process means putting in finances from the very onset to ensure that there are activities, there is a robust system, there is adequate training, there is adequate resource. I pause it there and I take questions. I think time is running us out, but that was my presentation. Back to you, moderator.
Great. Thank you so much, Francis, for that. We have definitely learned a lot. For a moment, I felt sad about the story, but then I'm happy we are finding solutions to such things not happening. So there's some questions, and as you want to ask live, please just raise up your hand, and then I'll be able to give you a chance to be able to ask the question. My first question on chat, Francis, what other participatory what you had presented? What other participatory process? 3 questions on the Q&A. One of the questions is, what other participatory processes can be? You've had the question, Francis?
What
Hello?
other participatory processes? You're breaking up, but I think I'm trying to hear you.
Yes. So what other participatory processes can be used? Let me ask 2 questions. Yes. Then another person is asking, Abdurrahman asks, thank you, Francis, for the best session in my site. My question is, how can I build my performance monitoring and evaluation? How can I build my performance monitoring and evaluation? And then finally is, when do I start baseline assessment? When do I start baseline assessment? Those are the 3 questions that we have on Q&A.
All right. Let me start with other participatory methods. When you're doing when we're doing a gender analysis, there are many participatory methods because there are various tools that we can actually use depending on the framework of gender analysis. You realized in my presentation, I said embed a framework for gender analysis. I've not been specific on one particular framework. There are several frameworks. In the frameworks, there are several proposed tools that one can actually use to do an analysis. And many of those tools are very participatory. For instance, there is an activity profile. that basically looks at the time burden and tries to take a whole clock around a man and a whole clock around a woman, around the boy, around the girl, to see from the time they wake up to the time they go to sleep, what do they do hour by hour. That's a very participatory method. So there are many participatory methods. There is, you can use a problem tree, is another participatory method that you can use for data collection. There is a vignette. You can actually use it for, there is a for participatory method. There is a picture code. You can actually use it for a participatory method. So there are many. There is then there is a focused group. There are several other many participatory methods you can use. But the bottom line is ensure that you're engaging the target audience in the entire process of the evaluation. And so when you go to the specific framework, my recommendation is identify the framework that you want to use for your analysis based on what you want, or based on the objectives of your gender analysis, the objectives of your intervention. Once you've settled on the gender analysis and you've defined the scope and your objectives, then you say which tools are best suited to help me get this data from my target population. Then from the array of data from the array of tools that are available, then you pick the best, you pick the tool that you want to use. And in all those, there are tools that are already recommended to use as you collect data by different domains. So how do I build in or improve your M&D system? So as I was talking through, I mentioned through various processes that you need to put in place. You see, I normally look at things from the entire systemic view, not just the M&D system is part of a whole system in the program. If we are to talk of the program as a system, is a whole program. So how do you build it? You build it from the very onset, from the very onset of the program. When we are designing interventions, and I normally say, let program teams work together. Don't say, no, this is our turn for programmers to think through a program. No, let the M&D person who will help in the monitoring sit through and hear the program discussion, so that when he's going to collect data, he has an idea of what this program is doing and what data this program wants. Let the program people not think data is business of the M&D team. Data is our business. They are collecting our data as programmers. So it begins from that point. So if you want to build a strong performing M&D system, start it from the onset, from the design of the intervention. Then from the design of the program to the creation of the interventions, the discussions around those interventions, then asking yourself, what are the best indicators to measure these interventions so that I get to my desired outcome? Then you follow it up to what tools will we require to ensure that we are able to measure these outcomes. So you have the correct indicators, then you have the correct tools, you have the correct system, then you are able to evaluate your entire work. So look at it from the broad programmatic systemic view, and you'll be able to achieve what you're looking for. So when do I begin? The third question is, when do I begin the baseline assessment? Before you begin, my recommendation will be, before you start your interventions, do your baseline. Do your baseline to understand what are the dynamics. Before you begin, the very, very first thing, these are foundational. The baseline is foundational. Do the foundational work. Do the gender analysis. And as I said earlier, and I want to repeat again for the sake of learning, don't just do the analysis and put it somewhere, or the baseline and put it somewhere. Let it inform your intervention, and let it be the base within which you are tracking progress. So as you do your quarterly review meetings, or semi-annual review meetings, or annual review meetings, come back and say, at baseline, this is where we are. 1 year down the line, we are here. We are not making progress, we are making progress, or we are not making the progress we had wanted to make as at this time, and therefore we need to relook at the interventions that we have and ask ourselves whether they're enabling us to reach where we wanted to reach. Give me the next set of questions.
Thank you so much for that. There are so many questions. I think I can, if you have a question, you can take this turns to raise up your hand, then we'll give you a chance to speak. And as you do that, There's someone who's mommy is asking, is M&D for everyone, or it's best to get an expert if the project permits? Is M&D for everyone, or it's best to get an expert if the project permits? And then I can see Francesca has raised up her hand, so I will not ask her question. And then I've had a donor request for baseline survey as opposed to baseline evaluation. Is there a difference between the two? I've had a donor request for baseline survey as opposed to baseline evaluation. Is there a difference between the two? And then another question would be, how do you implement a meal system into an organization? I think I would want one of these able to join my class, the meal class. So how do you implement a meal system into an organization? Those are the questions we can pick now as I give Francesca a chance to ask. Francesca, you can unmute and ask your question.
Hello, Francis. Can you hear me?
Yes, a bit faintly.
Oh, can you hear
yes,
me?
we can hear you. Yes.
Okay, thank you. So I was inquiring. You were talking about when you were talking about adaptive management, you are giving in as if steps. You say gender analysis, gender strategy, and gender streamlining. Are they steps or?
Okay, thank you for that, Francesca. I believe we've gotten the question. I don't see anyone else hands up, so maybe we can take that one. Or Yosef, yes. Yosef has a question. Let's pick that one as the last one, and then we can ask the question. Yosef, please ask your question.
Okay. Can you hear me?
Yes, we can hear you.
I'm Joseph from Ethiopian Catholic Church Social and Development Commission. So my question is, as you know that we are working in the pastoralist area in the border of Kenya and now from Ethiopia. So my question is this very interesting topic that we are really getting some good insight on gender today. So my question is, there are a lot of cultural barriers. Now, where we are working, South Omo East, there are about one province. In the province, you can see a lot of dynamics, culture, language, a lot of differences. So one of the culture allows us to do something, and the other culture doesn't allow us to do in order to incorporate gender issues. How to overcome gender barriers or cultural barriers to implement quality implementation in relation to gender or gender sensitive programming, planning, whatsoever. So just my question is, in short, cultural barrier is one of the challenge for us. So different cultures on gender. Thank you so much.
Great. Thank you for that question. Are we able to answer those? I still have two more, but we can answer those ones as time is not on our side.
Exactly. Let me go straight into the question on whether M&D should have an expert or should be for everyone. Yeah, we need experts who understand M&D. It's a technical area, but data is for everyone. M&D component, which as much as we can, if your project or your organization is well resourced, there should be an expert to help you monitor, evaluate, do accountability and learning in an effective and a good way. You should have one. But that data that is being generated by the M&D expert is for everyone. Program people should be able to consume that data, understand that data, because that is their data that they are generating from the field. Second question was what was the difference, or what is the difference between baseline evaluation or baseline survey? Semantics, it's different. They are just used different terms, but the bottom line is they just want to get to understand where are we starting from? What is a foundational thing? So some will call it, this is a baseline survey. Some will call it, this is a baseline evaluation. All of them, whether you're calling it an evaluation or survey, is a type of a research that enables you to establish what is your starting place, what are the indicators as you're starting, what are the issues, what are the gender dynamics, power dynamics. Then from there, you can be able to design what you move on. So when they tell you, give us a baseline evaluation, give us a baseline survey, they just want, where are we beginning from? And that will be my take on that question. There was a very nice question from Francesca on, I mentioned when I was speaking of adaptive management, mainstreaming, analysis, strategy, are they all steps? No, now, if it came out that way, my apologies, but this is gender mainstreaming is a goal. We want to mainstream gender across the entire programming. So when we say the title of our webinar today is embedding gender perspective into our monitoring, evaluation, and accountability system. When we are embedding, we are actually mainstreaming gender into our monitoring, evaluation, accountability, and learning system. So what are the processes or the steps of embedding? It begins with agenda analysis. Agenda analysis enables us to understand what are the issues, what are the inequalities, what are the power dynamics, what are the status of things as they are, what do we need to act on, what do we need to build on from the community. Then the gender strategy is built from the gender analysis. Once we have the findings, then from those findings, we build what are the strategies to respond to the findings. If I'm to go a little deeper, I'll say then we have integrated gender activities. What are the activities that we are going to integrate into existing activities? Then what are the activities that are targeted? What are the findings that need very targeted gender interventions to address them? So it integrated gender activities, targeted gender activities. So gender mainstreaming, embedding gender, overall goal, that's what we are trying to do. Gender analysis, then development of a gender strategy with an MEL system that is gender responsive are the steps that we take. Then we move to the fourth question, which is a question from my Ethiopian brother asking about how do we overcome the cultural barriers with the pastoral communities. I said in my presentation, one is that we must understand the context. Now, changing gender dynamics, changing perceptions and attitudes is a process. And it's a very long process. I don't know whether I can articulate everything in this short time, but I'll give it in a nutshell like this. In the process, we must understand who are the key people that we need to engage, who are the community leaders, the opinion leaders, the key people that we need to work with in the process. Then engage them from the point of co-designing, co-implementation, all through the entire process. Unless we work with these gatekeepers of the community, work with them through the change process, work with them through the change, the entire project cycle, they are going to act as a hindrance because they don't understand what is it that you're telling them about women empowerment, and they've grown up in this traditional patriarchal system. So it's step by step. Behavior change is a process from step 1 to step 2 to step 3 and requires patience. It requires proper programming. It requires engaging the correct people. It requires contextualizing intervention. What works in a different part of Ethiopia will not necessarily work in your pastoral area. So it starts by understanding what are the dynamics in your pastoral areas? What are the issues facing the pastoral boy, the pastoral girl? What are the issues facing the women, facing the men? Who are the key decision makers? How does power play here, a turnout here? Who do we need to engage? Who do we need to start with in our orientation, our sensitization sessions? Then step by step, we begin getting the change that we desire to see in the slow but gradual process. The last two questions, Sheila. Moderator, back to you in the last two questions. We already
yes, good. Sorry about that. I was saying we need to really, passionate, and I'm looking forward to having a training on gender because these questions are quite interesting and very insightful as we move along. So I'm giving you two questions. I'm sorry if I'll not be able to touch your question, but you can get in touch with us. So you can share an email. My colleague will share our details on chat. Email and WhatsApp number so that in case you have any questions, we can always be able to answer. So Abrao is asking, how do we tally gender male in emergency and development? How do we tally gender male in emergency and development? And then we have a very long question here from Onesfo. Onesfo is saying, thank you, Francis, for the great presentation. If gender aspects were not adequately emphasized during the design, monitoring, and learning phases, how can recommendations be effectively packaged during the midterm or endline analysis to inform future programming? And additionally, is there a comprehensive framework that links evaluation criteria with gender mainstreaming? If so, could you share some key insights on how to apply it in program evaluations. That's quite heavy.
How do we package? Let me start with that, then I'll move to emergency and development. How do we package when we did not set up? That is, to me, the gap first we should try to avoid as much as we can. Let's set up from the very onset, purposefully and deliberately, to set up the system to give us what we are desiring to get at the very end. We learned into the big problem when we did not set out to do, but now we want to tweak things so that it looks like we actually did this, so that we, the better we package this information, the better our chances for winning the next bid. It's a real tough work. I don't know whether I have a very, very straightforward recommendation for you there to say, do this, but my advice is, from the onset of the program, we must be able to really set out directly to be able to get what we want to, what we are seeking to, what we are seeking to achieve. That is what will help us, so that we do not work in retrospect. Working in retrospect can be extremely frustrating when the chief of party or the project director is insisting, I want to see this in the report. But when you flip back through the project reports, you do not see that coming out of the activity. Now, sometimes I ask myself, we can cook. By the way, we can cook these reports. We can cook a very nice story and cook things. But when a program audit is done, and I normally tell programmers, I'm very cautious of some of these stories that go into the reports, because there are some donors that are basically just moved with human interest stories or with things that we capture, and they might just decide, I want to go and have a feel of this good work that was done. Then we come out and we find that we tweaked it a little bit to look like what we actually wanted to achieve. That is the danger. So it's very tricky at times to tweak what was not set out to achieve something to make it look like it actually achieved that thing. The better way to do it is to set out the system from the onset to be able to get to where it needs to get. That's why I said, resource the process, be deliberate, be purposeful in doing this step by step, and in infusing these things and ensuring that it is getting you to the place it wants to get you. Then you asked, how can how a comprehensive framework that links evaluation criteria with gender. There are several gender analysis frameworks, and these frameworks depend on what you seek to achieve in the program. But one of the very common frameworks that I would like you to, after this session, you can Google it and just see it, see that framework, was done by Japaigo. It's called the Gender Analysis Framework. It has 4 domains of analysis. One of them is access, use, and control of resource. And it looks at both tangible and intangible resources, and how, who has access, who does not have access, what are the challenges. It looks around all that access to resource. And then you can customize it to whether it is health, whether it is agriculture, whether it is what. You can look at it, who has access to agricultural inputs, what are the resources, what are the challenges. It has a domain that looks at roles, practices, and beliefs, that basically looks at time burden and responsibilities. How is it distributed, whether it is equally or unequally distributed at the community. It has a third domain, which is not in any order as I'm speaking them, just the way I remember them, that looks at cultural norms and practices. What are the cultural norms and practices related to the particular field of study you're looking at? If it is health, what are the cultural norms hindering, for instance, uptake of nutritious foods, or hindering women participation in agricultural productive work, or women participation or minority groups participation in a particular thing? So you look at what are the cultural norms. Then the fourth domain looks at laws, policies, and regulations. It looks at the entire legal infrastructure in your county or in your country or in your geography of coverage. Do we have gender responsive laws? How is the distribution of resources? How is are those resources distributed according to need? And what needs to happen in that structural system? At the center of those 4 domains is power dynamics, because power speaks to all the 4 and looks at power to, power over, power within, and how that power affects all these 4 domains that I've spoken to. It is one very good framework that I've seen many partners adopt, but there are many other frameworks depending again on specifically what you want to use. Now, after that, after you've analyzed using that domain, I've seen again several partners put those analyses into the socio-ecological model, which looks at how different layers in the society intercept and interact to affect achievement of results to your targeted audience, from the individual at the center to the interpersonal space that has peers, friends, and family, to the next space that has the community, and to the overall space that has institution systems and structures. And pointing out to you that you might want to change the individual, but actually the touch point that you need to program around is the community, because as long as the community does not change, you cannot achieve the desired outcome to the individual that you seek to achieve. So I've seen people, again, taking those findings and subjecting them to the socio-ecological model and dividing them into the different layers and asking themselves, how do these layers then interact? Where do these findings fit in the system to ensure that the overall outcome to the individual I am targeting is able to be achieved? So there's no specific framework, but you can pick a framework that suits your intervention. Additionally, then, if you could share some key insights on how to apply it in program evaluation. When you're applying the gender perspective in program evaluation, again, go by the domain of analysis. Each framework has a domain of analysis, subject different questions, each domain of analysis with its questions. Then ask your targeted audience and come back to reflect and say, did our program increase access to resource? What are the constraints? What are the issues? At baseline, later on, when you're evaluating, at baseline, you're asking, what are the constraints to access to resource? We have intervened. When you're doing it at endline or evaluating it at endline, we're asking, did we address the issue of access to resource, just one particular domain, which I have used as an example. Then there is a last question on emergency and development programs. Emergency programs are more focus needs to be given to emergency programs, because in emergency setup, many other things do happen. And reading through lots of literature, this is a moment when an already vulnerable population becomes even more vulnerable because the systems around them become even weaker. Now, part of what needs to be put in there when there is an emergency is prevention of sexual exploitation and abuse. So that's one standard that we say in an emergency setup, there must be a system to monitor and to ensure there is prevention of sexual exploitation and abuse, because now these are participants, these are community members that are desperately in need of interventions. So that is something that we need to keep in place. It's totally different from a development area that does not have humanitarian or emergency situations that we need to respond to. Then when we look at that, we ask ourselves again, are the emergency interventions reaching the entire or the intended audience? There are cases in which emergency support is actually landing in the wrong hands. So there are additional other inputs based again on your emergency intervention that need to be monitored and need to be factored in an emergency situation that are not necessarily in a development program. Moderator, back to you. I wish I had more time. We'll have dug into
I wish to. That has been a very interesting webinar, and I truly appreciate what we have done so far. Apologies for those who were not able to share their questions, but again, my colleague has shared our details, our contact details. In case of anything, please reach out and we will be able to help you and support you. We will be having various courses coming up based on gender. Please make a point. If you're interested, reach out to us and we will be able to facilitate the same. If it's you as per organization or even individual, we will be able to ensure that your needs, your training needs are met. Thank you, everyone. This marks the end of our webinar. Looking forward to seeing you again next time for another interesting session like this one. Thank you once again and have a wonderful evening and day ahead. Goodbye.
My name is Evans Cheptiram. I'm the Operations Director at Beam Children's Foundation, a non-profit organization working in Tarbo, Eldoret, Kenya. We provide educational scholarships and mental health counseling to vulnerable children in the slums within Tarbo. I learned of Humanitarian Global through a friend and wanted to do a training on leadership and project management. And I got a chance to attend a training, a 4-day training on project management. And I've learned a lot. My take home would be the change management and communication that I intend to put into work once I get back to my workstation, and see to it that this improves the services that we deliver to our clients. Thank you.